All right, Anna, we'll have a look at your knees today. There'll be two parts in what we'll do. Initially, I'm going to ask you to do a few things whilst you're standing, just to test the strength of your knees and see if you get any pain with certain movements. And then we'll pop you up onto the examination couch where I'll have a closer look and I'll need to feel your knee as well, if that's okay. It's really important that during this whole procedure, if you tell me if you experience any pain or discomfort or anything that makes you uncomfortable, you need to tell me and we'll stop straight away. So first of all, I just want to have a look at your knees whilst you're standing, just to see what the muscle bulk's like and the symmetry and the positioning of your kneecap. Okay, that looks good. Okay, now if I can ask you to place your feet shoulder width apart, okay, and I'll just support your hands and I'll ask you to do 3 or 4 little half squats for me. So just 3 or 4. 1, 2, 3, 4. Okay, so when we did that, did you experience any pain in your knees at all? Okay. This time I'll hold your hands again and I'll ask you to squat right down onto your bottom. Now you can either leave your heels on the ground or you can lift them up. It's up to you. So squat right down onto your bottom for me and stay there. Now, are you experiencing any pain in your knees? Okay, that's great. And stand up and just relax for me. Okay. Now what we'll do is we'll have you up on the couch and have a closer look. All right, Anna. So what we'll do is we'll have a closer look at your knees. I'll look at them and then we'll have a feel and then I'll ask you to do some movements. As always, it's really important that you tell me if you get any pain or discomfort or you're not liking what's happening. You need to tell me and we'll stop straight away. So first of all, I'll just have a close look at both knees from all sides. I notice you have a little scar down here, which you told me before you weren't sure what that was the result of. There's no bruising or obvious swelling or deformities there. Okay, so that looks all pretty good. We'll just have a feel here, so just relax. I'll just feel for warmth, and they both feel quite normal and the same. And I'll just bend your knee up a few times just to feel that feels nice and smooth. So we'll just leave you in that position there, and I'll just have a feel of a few points. And again, tell me if it's painful anyway. Okay. Okay, now what I'll ask you to do is if you can push both knees firmly into the bed for me. So push them down into the bed, checking the muscle bulk there. That all looks good, good extension. Now, if I can ask you to slide both heels up to your bottom for me, as closest to your bottom as you can. Okay, and slowly down again. Okay, that's great, thank you.